Really excited today. We've come down to Hobart. We've got Stephen, one of our burns patients down here in Hobart, who will be having some treatment. And Selena's been working on Stephen for around about 2.5 years. So Selena's had some pretty outstanding results, and we've got some positive feedback from the burns clinic as well. But we are hoping to have this trial up and running sometime next year.
The cupping, as far as working on scar tissue, you're able to get much more of a pull and be able to have much more tension on scar tissue, having that negative pressure and being able to pull up and kind of spreading the scar tissue via cups versus, you know, that manual manipulation with your hands, which is actually very manually tiring on your hands. To be able to have the cup, and you can get much more of a widespread coverage using cupping than massage. Yeah, huge difference. So usually we just look at, we kind of take him through most of the movement and see where all the lines of pull come from, and I try and anchor a cup sort of on one end, and then we do the movement of the cup sort of through that line of pull of the scar tissue. I kind of treat the scar tissue rather than the muscle and the fascia underneath. So I kind of think of the scar tissue and the lines of pull of the actual scar tissue.
I was in a car accident 6 years ago, head-on collision. A pretty nasty one. It involved multiple injuries, nerve damage, broken bones. Unfortunately, the car caught on fire and I sustained burns to 35% of my body. The first time I had the cupping, I was reasonably nervous. I knew a little bit about a cupping from a book I'd read, and it involved the traditional Greek method, which was putting burning bits of paper inside cups. And being a burns victim, I was slightly terrified of that. But once Selena had explained the process, I was actually quite keen, because although the massage was working, I felt like we were chipping away at it, I suppose. I wasn't seeing, you know, those results I really wanted. And I think cupping gave us the chance to really get some good results, and it's proven that it has. So it was fantastic. Even that first one, I remember just sort of coming out, and just the looseness that I felt, which I hadn't felt for a good year. Just seeing those little differences in range of movement. After the first 3 weeks, it was just fantastic. I probably noticed the visuals less, but more the feel. Just the general range of movement I had, and just the softness of the skin was incredible. Just 3-4 weeks in. I find the treatment quite relaxing. There can be parts of it which are quite tense, I suppose. A lot of that's to do with my nerves, I think, though. Some of my nerves are a bit more tender than others.
So these have been fantastic, the bigger cups. And I've been asking Stephen when I've been using them, is there a difference? And he feels quite a difference with them, and we use it with and without the disc. And we've really noticed it's much better, because we can kind of get a lot more surface area when we use the bigger cups. Stephen comes once a week for an hour treatment each week, and so once a week for a good 3.5-5 years, isn't it? Yeah. The changes in the scar tissue over the 3.5 years has been huge changes. Initially it was quite hard, would move as one. Now you can see it kind of almost moves like normal skin. It doesn't have its binding, it doesn't seem to sort of move as one, it's actually moving, you know, it's kind of got contours to it. And now when I do manual massage on it, I can pick it up, I can move it, I can stretch it, I can mobilise it, whereas before it was very hard to even just pick it up and get a purchase on it. He was very bound up himself. His range of movement wasn't great. There was a lot of stretching. In fact, there probably wasn't even a lot of stretching of the scar tissue, because it just didn't give. And even just after the first 3 treatments, Stephen noticed a huge change. He was being able to laterally flex to the left-hand side within weeks, wasn't it, after the first?
Very quickly.
Very quickly. Most scar tissue is quite grey and silver looking, and as you can see, this is just beautiful and pink. There's a lot of movement in the scar tissue. It doesn't move as one now, it has good stretch, and also the sensitivity of it has decreased too over time.
I don't tend to look in the mirror, so I probably don't notice the visual as much as other people. But as I mentioned before, I actually had people stop me in the street and comment on my scars and ask me what I've done to maintain the scars the way they are. So, and cupping's a big part of that for sure.
A lot of this area around here is hypersensitive and kind of almost nauseating for him. So a lot of the treatment with the cupping is very light on, and we simply it's all very client driven. Some days it's a lot more sensitive than others, and a lot of parking of cupping more than gliding. We find the gliding can really ramp things up a bit.
Really irritates it.
Yeah, so around sort of the tricep, anterior shoulder is okay, but once we get sort of through this area, we really need to be careful. The myofascial cupping, once I introduced it into this sort of treatment, it's fantastic. You know, as far as on me physically, the treatment itself is not hard at all. Like, the cups do all the work for me. And as far as, you know, the actual massage side of things, now when I do go to massage him, it's because the scar tissue is freed up so much that the actual manual workload on me has reduced significantly. So we couldn't have done this probably even a year ago.
I wouldn't have gone that way at all.
And the scar tissue wouldn't have allowed it, and two, the cups would have popped off by now, because it would have all just moved in one movement. And he didn't have this kind of range, and that external rotation's fabulous compared to what it used to be.
You're not massaging a brick wall anymore.
No. And so now, you know, we can get in here, whereas before it was even just getting my hands in enough to be able to pick the scar up to move it was just an effort in itself.
Standard massage is compression, whereas what we've got here, we've got compression around the rim. So we create tension, standard compressional tension through the rim, and then through the centre of the cup, we've got tensional pressure. And there's nothing else, no other massage technique can offer that. You might get a little bit with skin rolling, where you're actually raising up of the skin, but to actually get that pull, there's no other massage technique that does it. So that's why it's so effective, and so effective on scarring, because you're creating that tension through the tissue. Placing it on the retinaculum, and then with the pump still on and getting him to move through that range.
Yeah.
Letting it pop off, does that help?
Yeah, we have been doing that too, haven't we? This kind of stuff.
Just leaving the pump on there.
So, try and go as far as you can. Yeah. How does that feel?
Good. Can feel sensation. Definitely like nerve tingling.
Okay, just pop down. So a lot to do with strength training as well, and physio. So it's not just the cupping, but we think the cupping has definitely helped to free up the scar tissue, as well as helped with the lymphatic drainage in this arm too. So his hand doesn't get quite as puffy, fingers still do, but his hand itself isn't. So now he can pick up a glass of water, which he couldn't do when you first came in.
No.
So now, and for that reason too, he's using this hand a lot more. The burns clinic have been fantastic and really open for us to run the clinical trial, but the actual reality of getting a scientific clinical trial up and running is actually quite daunting and challenging. So there's a few areas that we need to look at on where to actually go from here. But I think with the basis of what we're actually trying what we're trying to achieve, I think that will be enough to actually propel us on through.
I'm super excited about the trial actually. I'd love to be able to help other people going through similar things to what I am. I think it's a great opportunity. I've been to the burns clinic and you see some of the burns victims in there with their scarring, and I feel guilty sometimes that mine is so good and they're still struggling with theirs, and I think coupling is an important part of that, so I'd love for them to be able to take advantage of it too.
Ultimately, we'd like to be able to provide this kind of treatment within the hospital setting and have it offered to all burns patients as part of their ongoing treatment within the clinic surroundings. Because at this stage, they need to come to me for private treatment, which is not very available to most of the burns patients. So being able to offer it as part of their ongoing treatment actually within the hospital setup would be the ultimate goal, I think, of the clinical trial.
It's just been phenomenal what Selena has done in providing some awesome treatment protocols to soften up the scar tissue. You could see the redness that's come back into that scar tissue as well. There's been a huge change in how things look. He's got range of motion as well that's come back into play with his shoulder. So we've had some really nice results which you've seen today. We're super duper excited about the future. So thanks for joining us.